Addison's disease, also known as primary adrenal insufficiency or adrenal insufficiency, is a rare but serious condition that occurs when the adrenal glands fail to produce enough cortisol and, in some cases, aldosterone. The adrenal glands are small, triangular-shaped glands located on top of each kidney and are responsible for producing several important hormones, including cortisol and aldosterone, which play crucial roles in regulating metabolism, immune function, blood pressure, and response to stress. Here are some key points about Addison's disease. Causes: Addison's disease is most commonly caused by autoimmune destruction of the adrenal glands, where the body's immune system mistakenly attacks and damages the adrenal tissue. Other less common causes include infections such as tuberculosis or fungal infections, cancer metastases to the adrenal glands, genetic factors, and certain medications. Symptoms: The symptoms of Addison's disease can be nonspecific and develop gradually over time, making diagnosis challenging. Common symptoms may include fatigue, weakness, weight loss, decreased appetite, low blood pressure, hypotension, dizziness upon standing, orthostatic hypotension, salt cravings, darkening of the skin, hyperpigmentation, nausea, vomiting, abdominal pain, diarrhea, and muscle or joint pain. Diagnosis: Diagnosis of Addison's disease typically involves a combination of medical history, physical examination, blood tests to measure cortisol and aldosterone levels, and tests to assess the adrenal gland function, such as the adrenocorticotropic hormone ACTH stimulation test or the insulin tolerance test. Imaging studies such as CT or MRI may be used to evaluate the adrenal glands. Treatment: Treatment for Addison's disease involves replacing the deficient hormones with medications. This usually includes oral glucocorticoids such as hydrocortisone or prednisone to replace cortisol and, if needed, oral mineralocorticoids such as fludrocortisone to replace aldosterone. Patients with Addison's disease may also require additional cortisol during times of illness, injury, or stress to prevent adrenal crisis. Complications: If left untreated or inadequately managed, Addison's disease can lead to potentially life-threatening complications such as adrenal crisis, a sudden and severe worsening of symptoms due to a lack of cortisol. Adrenal crisis is a medical emergency and requires immediate treatment with intravenous fluids and corticosteroids. Prognosis: With appropriate treatment and monitoring, most people with Addison's disease can lead normal, healthy lives. However, lifelong hormone replacement therapy is necessary to maintain hormone levels within the normal range and prevent complications. Close monitoring by healthcare provider is essential to adjust medication doses as needed and to watch for signs of adrenal crisis or other complications. Managing Addison's disease requires ongoing medical care and adherence to medication regimens. Patients with Addison's disease should work closely with their healthcare providers to develop an individualized treatment plan and to learn how to recognize and manage potential complications.